We begin with the state health department reporting today 8 more people have died after contracting COVID-19, and this raises the COVID death toll in Hawaii to 985. In this past week, there have been 18 new deaths. Now, the Department of Health also reported 142 new cases of COVID-19. That's 94 for Oahu, 15 for the Big Island, 13 for Kauai, 11 from Maui, and 9 more residents who were diagnosed out of state. There have been more than 86,000 COVID cases in Hawaii since the start of the pandemic, and currently there are about 1,300 cases that are considered active. However, not part of today's state count, 19 new cases reported over on the guard now. According to the Kauai District Health Officer today, 1 visitor and 18 residents have tested positive for the virus. 4 of them are children, and there are now 125 active cases on Kauai, 12 people on the guard now who are hospitalized with COVID-19. Now, the Centers for Disease Control and Prevention says its forecast for COVID-19 deaths in the U.S. over the next month is uncertain. The CDC predicts the number of newly reported deaths connected to the virus will either remain stable or experience an uncertain trend over the next 4 weeks. Projections show 6,300 to 10,000 deaths could happen in the first full week of December, with an overall COVID death count close to 800,000 by the end of the year. The agency stresses rapid changes are unpredictable and difficult to pinpoint. 2 big announcements could come before the end of the week, one on boosters and another on experimental COVID-19 antiviral. As Britt Conway reports, timing is crucial.
We're not going in the right direction.
Because that direction is up. The U.S. is now averaging more than 82,000 new COVID-19 cases a day, up 11% over the daily average 2 weeks ago.
This is exactly where we did not want to be coming into this winter, but we do have tools at our disposal.
One of those tools, boosters, though they're only available for certain groups right now. But Tuesday, Pfizer applied for emergency use authorization for boosters for all adults.
At this point, we know that immunity wanes over time. We also know that a 3rd dose of the Pfizer-Moderna vaccine will substantially increase immune protection again.
The FDA says its vaccine advisors will not meet to discuss the matter, which means the FDA's decision on authorization could happen any time.
For the FDA to say everybody, all adults, should be getting a booster dose will be really huge to clarify that muddled messaging that never should have happened in the first place.
Another potential tool in the fight against COVID-19 is in the works. Pfizer's experimental antiviral pill called Paxlovid. The company has applied to the FDA for an EUA, and a source says the White House is finalizing a contract to purchase 10 million doses of the drug, with an official announcement expected as soon as this week. The pill could become an important weapon in the battle against the virus, especially as cases rise and winter closes in. I'm Britt Conway reporting.
Now, in Hawaii, the state is reporting 77.7% of the eligible population in Hawaii is now fully vaccinated, and that includes everyone ages 5 and up. There have been a total of 2.3 million doses that have gone into arms, and it's estimated that 394,000 people of all ages in Hawaii are not fully vaccinated. Right now, only certain people are eligible for the COVID-19 booster shots in Hawaii. And according to the state health department, they include those who received their first Johnson & Johnson vaccine at least 2 months ago. For Moderna and Pfizer recipients, a booster is recommended at least 6 months after their second dose if they're 65 years and older, an adult living in long-term care, people who have underlying medical conditions, or those who work or live in high-risk settings.